Well, it's day 20 post 2-level ADR LP ESP disc with Dr. Riske. Happened on February 28th. It's now the 20th. On day 10, I had to have an emergency balloon kyphoplasty. Because my L5 vertebra was getting crushed from both directions. But anyway, day 20, it's a little later in the day. This is like the second video I made this morning. I did try to go back to sleep. I found myself, I woke up in the middle of the night and I was on my side with my knees together. Found out I was having some back pain. I wasn't in that 1 to 2 range where I was at previously in the night. I'm supposed to be sleeping on my back, zero gravity, not putting any twisting or bending on stuff on my spine. This bed is flat. It doesn't have memory foam on it. If I was at home in my bed, I've got a really nice, Select Comfort memory foam. Well, I got a Select Comfort mattress, so I can lower the pressure way down to like, 30. And it's got a 2-inch or 3-inch memory foam topper on it. And the way I sink into that thing, when I got it on 30 and I'm trying to sleep on my back, I'm not going to roll over. I'm not going to turn. I'm going to stay on my back because I'm just sunk in so far. It's almost physically impossible to roll over. In fact, you kind of got to inflate the mattress back up to get out of the bed because it's the way I can sink myself down into it. But anyway, I don't know, something to strap yourself into bed, laying flat on your back so you don't end up waking up on your side. I don't know, but it's something that needs to be, you need to try to sleep on your back. Because the pain in my back is not as light as it was after I woke up earlier this morning. So anyway, I want to talk about pain meds and keeping track of them. It's now 7 in the morning. I took my last, I took another Tramadol at like, 1:30 or whatever this morning when I woke up the first time. But anyway, so it's time for me to take another Tramadol 50, right? When you're taking Tramadol, or any synthetic opiate, you run the risk of constipation. So I pair that with Pericolates. Celebrex, it's time to take that. If you're taking ibuprofen or anything, this is Celebrex once every 12 hours. If you're taking ibuprofen every 4, 6, or whatever, if you're taking that much every day, you have to pair that with some kind of something to protect your stomach acid. In this case, I'm using their version of I think it says protein pump inhibitor or something like that. Profen pump inhibitor is the way they've got it. I'm trying to get a good shot of this where it's visible. Profen pump inhibitor or something like that. But anyway, reduce your stomach acid if you're taking NSAIDs and stuff every day. I was able to go back to the pharmacy and take my form and get some more Daflagal Paracetamol, which is basically acetaminophen, Tylenol. So these are all my pain meds paired with constipation and stomach acid relief. Calcium supplement, taking 2 of these in the morning. I'm taking 2 of these with every meal along with 5,000 units of vitamin D. I'm doing my scar tissue, cream repair and stuff like that. When you're in the hospital, the nurses take care of all this for you. They come every so many hours and give you your dose, give you a glass of water to drink that. Nurses do a very important job keeping track of how often and how, when you should take your medicines. It's a very important job, but mistakes can be made. I made a personal mistake last night. I forgot to take my Strontium Boost. This is something that's AlcioCal pairs with this Strontium Boost, where you're taking this during the day and you take this at night. That they've proven studies that when you're taking, this at day and this at night, they've had proven studies of bone growth and stuff. So you got to pair this together. So I made a mistake last night. I forgot to take this. Another thing that I've been having to do, I haven't done it the last few days because I'm down to my last one. I'm saving this injection for the plane ride back home. This is stuff to prevent blood clots in your legs after surgery. I forget how many days initially I got. I ended up having to get 2 boxes because I had to split it up because it was a big box like this and then there was a smaller box. But I forget how many days I was. Dr. Riske prescribed this to me, but they'll give you a guide. They'll give you a guide that has the steps of how you got to clean the injection site with alcohol swab. Get the syringe ready by removing the tip and folding it back, pulling off the protective cap and layer. Air bubble, very important. You do not want to inject this air bubble into your skin. It's painful. Trust me. Hold the syringe, thump it a couple of times. Make sure that the air bubble, they're trying to show a good picture here, but make sure the air bubble is at the top of that syringe and not, at closest to the rubber part. Make sure it's, and hold it, keep it vertically like that so that it's upright and the bubble's at the top, because you want to inject the liquid into your body, not the big air bubble. You inject you fold your skin, you inject it in, and then you have this cap protector and stuff like that to throw it away. And then they recommend disposing in a Sharps container. I don't have a Sharps container. What I've been doing is I don't want to put them in the regular trash. I've been saving my needles in an old yogurt cup in the kitchen. I am running into some different problems. Here's one problem I've got. That trash can is full, and that would probably require more than 10 pounds of effort to lift that thing out and take downstairs. So what to do with a full trash can? Well, what I've decided to do is to make little trips. I've got a little bag here, and I've been keeping some more of my trash up here upright. That every little trip I make out, like I'm going out for 3 or 4 walks a day. Every little trip I go, I'm gonna take a little trash with me, put it in a public trash can, and then save my bag for the next trip. But that's how I'm gonna handle trash, and get around being able to empty and lift that. Hopefully it doesn't stink too much in the next week. But anyway, that's how I'm gonna handle trash.